So thank you for coming to this session. This is an awesome session. This is the one. You come to the right one. And this is called Consider Your Words, How Online Interactions Add Value. And so the setup is we have 3 speakers. They're going to talk about 15 plus minutes. And then we have like a 5-minute Q&A. So while you're there talking, so please write down some questions. And I'm going to run around with some microphones because this session is being recorded. So yeah, let's just have a dialogue. This session is only have 3 speakers. Most other session has 4. So we have some extra time. So if you want to like converse a little bit more, that would be really awesome. Okay, so the first speaker is Kunal Patel. And the title is Interprofessional Online Learning for Primary Healthcare Teams, Finding from a Scoping Review.
Great.
Welcome.
Well, thank you. Wow. Now that I've heard that out aloud, that's quite a long title. Probably should have changed it, but it's a bit late now, right? But look, it's Sunday morning, and usually at this time of the day, I certainly wouldn't be normally giving a lecture, not back home in London. It's usually football day, usually a bit of soccer. So we're going to hopefully make this a bit relaxed, and I'm not going to be too academic about things because there's a lot of detail online. I'll tweet later on about the report. You can get the link online and have a little bit more detail into it. But just to get the blood flowing a little bit, I just want to ask a quick question, literally just seeing who you guys are, because it's something to think about when we think about the word interprofessional. So I want to ask you guys, raise your hands if you're a physician. Okay, so we've got 3 there. Raise your hand if you're a physiotherapist. None. Okay, raise your hand if you're a nurse or nurse practitioner. 1. Okay, raise your hand if you're a speech and language therapist, or an occupational therapist, or a physiotherapist. Raise your hand if you're a technologist or an educational expert. Okay, so we actually have more people, non-traditional healthcare workers in the room. And that's kind of cool. I like that. I don't want to talk to medics all the time. So, that's always nice. But something to think about down the line in terms of how we approach healthcare and learning and collaboration. But to even get the juices a bit more flowing, I thought, you know what, I'm coming to California. I want to talk about nice things. And this guy is one of the nicest things I could think of, right? Yeah. And it's a bit sad what happened, of course. But that's him backstage on Young Frankenstein. And I kind of wish I could do what he was able to do in that film, if you remember the scene where he talks to loads of scientists and then shocks them by saying, I'm going to talk about body reanimation. That would be pretty cool, but I can't. But his life was very interesting. And basically, his ex-wife was diagnosed with ovarian cancer, Gina Radler, many, many years ago. And he became a big advocate for cancer. But then he himself got diagnosed with non-Hodgkin's as well, not shortly after that. And then as we have subsequently found out that he passed away sadly due to the complications of Alzheimer's. So he actually, during that time, became a huge health advocate. But if you think about those unfortunate diagnoses that they had, there's a lot of interprofessional collaboration around those diagnoses. Cancer, dementia. You think about the teams that try to optimize patient care. That'd be, your physios, your psychologists, your physicians, your speech and language therapists, and so on. They've all got to work together interprofessionally to provide the best care they can for the patients. So if we were going to blow that up a little bit more, and we think about it from a global context, it is very clear that by 2035, we're going to have a massive health worker shortage. We're talking 12.9 million health workers.